Hello and welcome to my channel. This is Isaac Simply. Thank you for tuning into my channel. Kindly, if you have not yet subscribed to my channel, kindly subscribe, like, and share. This is a channel where we shall talk about issues concerning averting HIV and sexually transmitted infection stigma. And we shall say that being positive about HIV is not necessarily being HIV positive. Thank you. Today we'll be talking again about HIV. And in our topic today, we'll be discussing the clinical stages of HIV infection. Before I get to that point, allow me to discuss what is HIV. Basically, HIV in full, we call it human immunodeficiency virus. And this is an RNA virus that usually interferes with immune system of the infected person, and that's why we call it an immunodeficiency virus. Are we together up to this point? Thank you. Now, when you have acquired HIV, either through coitus, through blood transfusion, or through any other form of transmission, you land in stage 1 HIV infection. In this stage, you may not exhibit any kind of symptom, or for other persons, they may experience enlarged lymph nodes, what we in other words call it a generalized lymphadenopathy. So for the stage 1, this is the main symptom that they experience, a generalized lymphadenopathy. But in other people, they do not experience any kind of symptom in stage 1. Now, we go to stage 2. Stage 2 basically does not have severe presentations. Rather, you may experience dermatological presentation. People also experienced weight loss that is less than 10% of their body mass. Some of them experience recurrent respiratory infections. These are the likes of rhinitis, the likes of sinusitis, and other may experience pneumonia in recurrence. Dermatological conditions include fungal infections, viral infections, the likes of herpes zoster. Other people may experience recurrent oral lacerations. Other people may experience angular cheilitis, while others may experience papillopruritic eruptions on their skin. Are we together up to this point? Thank you. So, in simple words, stage 2 entails respiratory infections, that is non-severe. This includes upper airway infections, lower airway infection, and dermatological skin conditions, including fungal, like we have said, pityriasis, viral, the likes of herpes zoster, and also papillopruritic eruptions that may be viral or maybe bacterial. Are we together up to this point? Thank you. Now, let's go to stage 3. Stage 3, the symptoms of this person are a bit severe. This is for one reason, their CD4 count is going down. In this case, they have a CD4 of roughly below 500 copies in a milliliter. They also have a very high viral load because they have stayed longer without intervention with this virus. So they will experience weight loss of more than 10% of their body mass. They may also experience diarrhea of more than a month. They may also experience unexplained fever. These persons may also experience severe respiratory conditions like pulmonary tuberculosis. They may also experience severe pneumonia. In this case, they may also experience other bacterial infections, includes bacterial infections to the muscles, what we call pyomyositis. They may also experience anaerobic bacterial infections, what we call empyema. That is the infection by anaerobic bacteria, which usually cause pus in some parts of the body, includes muscles. They also experience in the lungs what we call empyema thoracis and such kind of presentations. These persons also experience oral hairy leukoplakia. These are whitish patches that usually appear on the mouth. Let's go to stage 4. Now, for person to get to stage 4, it means they have stayed a bit longer with HIV. Their immunity has been suppressed severely and the viral load is on the roof. These are persons with CD4 of below 200 copies at this point, with a viral load of over 1,000 copies. Now, how do they present? These are the persons who will present at the facility on their first diagnosis with extrapulmonary tuberculosis. This is the tuberculosis that has gone beyond the lungs. Could be meningitis, could be abdominal, could be any other part of the body that is not the lungs. They may also present with cancerous conditions like Kaposi sarcoma. This is a cancer of the skin. May present with cervical cancer. May present with other protozoal infections like isosporiasis, cryptosporidiosis, toxoplasmosis, and also may present with PJP or pneumocystis jirovecii pneumonia. They may also present with HIV wasting syndrome, and other presentations include what have I not said, like chronic herpes infections. Could be type 1 or type 2 or both of them. Are we together up to this point? Thank you. So kindly, for you to be able to learn more about HIV infection, these are some of the presentations that we experience for us to be able to categorize each newly diagnosed HIV individual according to the right stage. But kindly remember that having HIV or having diagnosed at stage 4 does not mean that you will not recover. So most of them recover even after being diagnosed at stage 4. If it's a manageable condition, it is managed and the immunity can be built up over time, and this person can get stable again while still at stage 4 and continue with treatment for a very long period of time, being a stable HIV positive person. Are we together up to this point? Thank you. Kindly, if you have not subscribed to my channel, kindly subscribe, like and share. And also remember that HIV does not kill, but the opportunistic infection associated with HIV infection can kill. So for us to be able to reduce the mortality of HIV, it's better for us to be able to manage properly the opportunistic infections, and also advise everyone, if it's your relative, your friend, or your colleague, to take the drugs appropriately. Do not miss your doses. If you are initiated on care, kindly adhere to your treatment. for you to avoid opportunistic infections. Are we together up to this point? Thank you. Have a nice time and God bless you. Bye bye.